the hospital. All right, any questions with that? Fortunately, Baytril, which is another gram-negative antibiotic, doesn't have the same problem, so you will probably use Baytril first, and rofloxacin. NSAIDs, I was going to say there in NSAIDs. You remember the prostaglandins? We talked about this. So you need the prostaglandins to vasodilate the afferent, the inward portion of the glomeruli, right? If you block that because you're trying to decrease inflammation, well, you're gonna lower the prostaglandins that cause the inflammation. Those are mostly COX-2, right? COX-2 derived. But you are going to decrease some of the constitutive prostaglandins, like derived from COX-1, and those are prostaglandins that allow renal blood flow to continue. And this is especially important if you have a patient that has pre-renal azotemia, dehydration, is going to undergo anesthesia, and they have low cardiac output, or they're going to undergo a splenic tumor removal, and they're going to bleed on the OR. That's when this effect. When these prostaglandins are necessary, basically. And if the patient is on NSAIDs, they are at high risk of renal failure, intrinsic renal failure, renal failure, if that makes sense. And so how do you treat that? Misoprostol, you can actually give prostaglandins to the animal. That's a good thing. However, when the damage is done, you need to treat the renal failure too. So an NSAID toxicity may require misoprostol cytotec, this is a synonym for that, to give the prostaglandin analogs. However, the damage is kind of done at that point, right? So you should also treat the renal failure. Hypercalcemia. Now with hypercalcemia, what would be the number one reason you have hypercalcemia in acute kidney injury? 5 points, bonus, whoever can answer it. Hypercalcemia, acute renal failure, what's the number one reason?
Hypercalcemia.
Not producing. You're on the right track.
Oh, the loss of phosphorus. Yeah, because then the loss of
Yeah, but why? Why?
Does it have to do with cholecalciferol?
So how do you get cholecalciferol in your body? You have a rodenticide, alright? So now you have rat bait that has cholecalciferol to kill rats. So instead of using anticoagulants like before, they're going to cholecalciferol analogs to kill the rats. So if you have an acute rat bait intoxication, now you have to think not only to check coagulation, but also check the calcium. Yeah? And the reason is the FDA is moving away from having rat bait for kids, you know, like a baby can ingest it and bleed to death, and now they just have them on dialysis and renal failure. So it's a decision that the FDA made. That this is a new trend. Rodenticides are going to become, and are becoming, a lot more hypercalcemic driven. So I'm not talking chronic renal failure, that's margin, that's a different reason. I'm just talking acute renal failure from hypercalcemia. That would be probably the number one reason. Rodenticides with cholecalciferol. So how do we decrease the calcium? Well, we can do diuresis, calciuresis. How do you induce calciuresis? 0.9% saline. 2 to 3 times maintenance, all right? And that's after you hydrate them, no? If they're dehydrated, you replenish that. If they're in shock, you deal with that. But after they're hydrated, you're kind of causing them to become overhydrated with 0.9% saline. You're a lot of chloride in that macula densa, and that's going to make them pee out calcium. What's another good way of inducing calciuresis? You're awesome, Mike. So you see, like I highlighted that area of the glucophenolate, and you can see that as sodium, potassium, and chloride get absorbed. And I can't even see it here, let me put it up like that. Calcium is also passively reabsorbed because of that gradient. And so you can block that by blocking that receptor with furosemide. So this is probably the only time that I would use concurrent fluids and furosemide. Right? It doesn't make sense otherwise. You're causing diuresis, extreme diuresis, because your goal is not to lose water, your goal is to lose the calcium. And there's a third way to increase calcium excretion, which is with steroids. And that mechanism is a little trickier, but it has to do with increasing the sensitivity to ANF, atrial natriuretic, or ANP, atrial natriuretic peptide. Yeah.
Oh, I just want to let you know that it was
Okay. Well, we'll leave it right there and we'll finish tomorrow.